Most men protect their heart, their brain, even their joints. But they forget something just as vital: your penis ages too. And if you ignore it, you won't just lose performance. You'll lose confidence. You'll lose dignity. You'll lose a part of yourself no one else can replace. Too many men suffer in silence, not because they're weak, but because no one ever taught them how to care for this part of their body. As it changes. But that ends today. Because in this video, you'll discover 5 essential ways to care for your penis as you age. These aren't gimmicks. They're not magic pills. They're simple science-backed habits that can change everything. Whether you're single, married, widowed, or somewhere in between, this isn't about trying to be who you were at 25. It's about reclaiming who you are now, a man with wisdom, value, and yes, desire. And here's the best part: you can start today. No prescription needed. No shame. Just the willingness to care for yourself in a new way. But before we dive in, do me a favor. Hit that subscribe button and turn on the bell, because here we talk about real men's health. No fluff, no shame, just truth. And if this message already speaks to you, type 1 in the comments. If not, type 0. Either way, I want to hear from you. Because your voice matters more than you know. Step 1. Stay sexually active. Even without intercourse. When most men reach their 60s, they quietly accept something that isn't true. My sex life is over now. But let me tell you something important: that belief is not only untrue, it can actually become the reason your sexual function fades in the first place. Here's the truth. Your penis, just like your muscles, your heart and your brain, depends on use to stay healthy. If you don't use it, you lose it. It's that simple. This phenomenon is known as penile disuse atrophy. It happens when blood flow decreases, elasticity weakens, and tissues begin to atrophy. And it's more common than you think. But here's the good news. This atrophy is completely preventable. And you don't need expensive pills or risky procedures to fix it. What you need is regular use. Now, I'm not saying you need to have intercourse every day, but staying sexually active even without intercourse is key. Masturbation, for example, is not just about pleasure, it's about preserving your health. By keeping blood flowing to the area, you're maintaining healthy tissue oxygen supply and function. It's just like stretching a muscle to keep it flexible and prevent stiffness. If intercourse isn't currently an option, that's okay. There are other ways to maintain circulation, such as using a medically approved vacuum erection device, engaging in pelvic floor exercises to support circulation and performance. What matters most is that you don't go idle. Your body responds to use no matter your age. And beyond the physical benefits, there's something even more powerful at play: your dignity and identity. For many men, sexual vitality is tied to how they see themselves. When that begins to fade, confidence often goes with it. But when you stay sexually active in whatever way works for you, you're not just preserving performance, you're preserving pride. It's not about being who you were at 25, it's about staying connected to who you are now. A man with wisdom, experience, and value. I've seen men in their 70s regain control of their sexual health just by taking this first step. And once they do, other parts of their health start improving too. Confidence, intimacy, motivation, they're all connected. So remember this: your sexual health doesn't have to fade with age. It's up to you to keep it active, keep it engaged, and keep it alive. Step 2. Keep it clean. The right way. This may sound like common sense, but let me tell you, it's one of the most overlooked yet crucial aspects of maintaining your sexual health as you age. I've treated hundreds of men in my practice who came in with infections, irritation, and sometimes even more serious conditions, all because no one ever taught them how to clean themselves properly. As we get older, our bodies change. The skin becomes more sensitive, our immune systems don't fight off bacteria as quickly, and we don't heal as efficiently. What may have been enough hygiene when you were younger might not be good enough now. And for men who are uncircumcised, the risk increases. Sweat bacteria and dead skin can build up underneath the foreskin, which can lead to infections like balanitis or worse, increase the risk of penile cancer. Yes, cancer. It's not rare. In fact, some countries like Brazil have some of the highest rates of penile cancer, and the #1 cause is poor hygiene. But here's the good news. It's easy to fix. You don't need special tools or expensive treatments. Just a simple, consistent cleaning routine can make all the difference. Here's what I recommend. Wash gently with warm water and a mild, unscented soap. If you're uncircumcised, gently pull back the foreskin and rinse thoroughly. Dry well moisture can be a breeding ground for bacteria, especially in skin folds. And always clean after sexual activity. Whether it's vaginal fluids, lubricants, or natural sweat and oils, they can throw off the balance of healthy bacteria on your skin. I know it may seem like a small detail, but trust me, this small daily habit could save you from painful infections, foul odors, and even much more serious conditions. What surprises most men, though, is the emotional shift that comes with this. When you start caring for your penis the same way you take care of your teeth, your heart, or your skin, you start feeling differently about yourself. Cleaner, more confident, more in control. That confidence carries over into every part of your life. It's powerful, especially in a world that often tells older men to step aside or give up on their bodies. But remember, hygiene is just the beginning. There's something even more important that most men overlook. Let's move on to step 3. Avoid sexual activity with a semi-erect penis. Step 3. Avoid sexual activity with a semi-erect penis. Now, this is one that may surprise you. It seems like a small thing, but I can't tell you how many men I've seen over the years who've unknowingly injured themselves because they didn't realize the risks of having sex when they weren't fully ready. You might think it's just a little softer, but I can still make it work. But let me be clear, attempting penetration with a semi-erect penis can cause long-term damage. Your penis isn't just a simple tube of skin. Inside, it's a delicate structure made up of blood vessels, spongy tissue, and smooth muscle. When it's not fully erect, it lacks the support it needs to withstand the pressure of penetration. So when you try to perform before it's ready, you're putting your penis at risk for micro-traumas, tiny injuries that you won't feel right away, but will slowly add up over time. These micro-traumas can lead to the formation of scar tissue beneath the surface. Over time, that scar tissue can harden and start to pull on the surrounding tissues, causing a condition known as Peyronie's disease. This is a painful condition that causes curvature of the penis, sometimes so severe that intercourse becomes difficult or even impossible. I've had men sit across from me in my office embarrassed to mention the changes they've noticed until it was too late for conservative treatments. And the truth is, most of them didn't even know this risk existed. They weren't being reckless. They were just uninformed. So here's the key message. Slow down. Your health, comfort, and confidence all depend on treating your body with patience and respect. Waiting until you're fully erect before intercourse isn't just safer, it's smarter. By allowing your body the time it needs to respond, you're protecting yourself from long-term damage. You're also ensuring that your sex life remains enjoyable and pain-free. And don't rush if you're using medications or other aids to help with erections. Let them do their job fully before proceeding. This simple act of caution could save you years of frustration and discomfort. Remember, it's not about being fragile. It's about being informed and empowered. taking your time isn't a weakness. It's a sign of wisdom and self-care. Now that you understand how to protect yourself during intimacy, let's move on to something that affects not only your body, but your mind as well. Let's talk about the unexpected cost of too much pornography. Step 4. Limit porn. Maximize real connection. Let's be honest, access to pornography has never been easier. With just a few clicks, you can find anything your mind can imagine. And for many older men, especially those who may be single, widowed, or feeling disconnected, it might seem like a harmless way to keep desire alive. But after treating thousands of patients over the years, I can tell you this: what starts as occasional relief can slowly replace something far deeper and more meaningful. And over time, it can rob you of the real connection you deserve. The truth is, excessive porn use rewires the brain's response to arousal. It trains your mind to rely on one specific type of stimulation, fast, visual, and solitary. And here's where the problem begins. Over time, your body becomes desensitized. The excitement you once felt from real-life intimacy starts to fade. You may still feel desire, but when you're with a partner, your body doesn't respond the way it used to. I've had men in their 60s and 70s tell me I feel confused. I still have the desire, but when I'm with my partner, my body doesn't respond the same way. They think something is broken inside them, but in many cases, it's not physical. It's psychological conditioning caused by overexposure to porn. And it doesn't stop there. Excessive use of porn can create feelings of shame, isolation, and low self-worth, especially when it becomes a routine that replaces real human closeness. You start to question your manhood, your ability to connect, and your value in a relationship. And that's a heavy weight to carry, particularly when you're already navigating the emotional challenges that come with aging. Now, I'm not here to shame anyone. There's no judgment. But I do encourage moderation. If you're going to use it at all, use it sparingly. Focus on rebuilding your natural arousal pathways through memory imagination or real emotional intimacy. That might mean taking more time with foreplay, talking openly with your partner, or simply allowing yourself to feel without pressure or expectation. Desire doesn't disappear with age. It just needs a different kind of attention. Limiting your porn consumption doesn't mean giving up pleasure. It means reclaiming it in a healthier, more meaningful way. You see, it's about bringing your body and mind back into harmony so you can experience true connection, not just stimulation. When you focus on real intimacy, you'll find that the excitement you thought you'd lost can come back stronger than ever. And speaking of harmony, there's one final piece of advice I want to share with you that ties everything together. It's the foundation that supports not only your sexual health, but your overall vitality. Step 5. Prioritize lifestyle over pills. If there's one thing I've learned after decades of treating men over 60, it's this: your lifestyle matters more than any prescription you'll ever take. Many of my patients come in hoping for a magic pill, a quick fix that will bring back the vigor and energy they once had. But the truth is, no medication can compete with the power of healthy habits. Your lifestyle is the foundation of everything: your blood flow, your hormone levels, your mental sharpness, and yes, even your ability to feel alive in all the ways that matter. Erections, for instance, depend on good circulation, and circulation depends on the health of your heart and blood vessels. So if you smoke, drink heavily, or eat poorly, you're damaging those vessels and limiting blood flow to some of the most vital parts of your body, including your penis. Here's the catch: erectile dysfunction is often the first warning sign of heart disease. It's your body's way of telling you that something deeper may be wrong. But here's the good news: every healthy choice you make today has an immediate and lasting effect. When you stop smoking, your circulation improves within days. When you cut back on alcohol, your testosterone can begin to rebalance. When you walk just 30 minutes a day or eat foods that support vascular health, like berries, leafy greens, and fatty fish, you're not just adding years to your life, you're enriching it. Here's what I love most. I've watched men transform their health, not by relying on pills, but by simply shifting their daily routine. They sleep better, they laugh more, they reconnect with their partners, they start to feel like themselves again, and they stop relying on pills because they've built something stronger, a foundation. Think about it before you reach for another prescription reach for your walking shoes. Choose water over whiskey. Prioritize rest and connect with others. Your body is listening to how you live, not just what you take. You see, the more you care for your body through everyday choices, the more you'll see results in every area of your life. Your energy returns, your confidence builds, and slowly your function follows. It's not about being perfect. It's about doing what you can every day to improve your health and vitality. So start today. And remember, you're never too old to invest in yourself. Now that you know the power of a healthy lifestyle, let's move on to a simple change you can make to enhance your comfort while you sleep. Bonus tip: sleep without underwear. This might sound like a small detail, almost too simple to matter. But trust me, it can make a surprising difference when it comes to your sexual health and comfort. Over the years, I've come to realize that some of the quietest habits we have often have the most powerful impact on our bodies. And one of those habits is what you wear, or more importantly, what you don't wear to bed. Sleeping without underwear may seem insignificant, but it can actually have a significant effect on your penile health. During sleep, your body enters a natural state of repair and regulation. For men, part of this process includes spontaneous erections that occur throughout the night. This is a completely normal and necessary part of maintaining healthy erectile tissue. It helps to keep your penile tissue oxygenated and supports its overall health. But when you wear tight or restrictive underwear, especially briefs or snug-fitting sleepwear, you may be unknowingly compressing your penis during these nocturnal erections. And over time, this pressure can lead to tissue irritation, reduced blood flow, and in some cases, the development of internal scarring. That scarring, particularly when it goes unnoticed for years, can lead to a condition called Peyronie's disease, which causes painful curvature of the penis. And believe it or not, this condition is far more common in older men than most realize. So, what's the solution? Sleep without underwear, or at the very least choose loose-fitting boxers instead of tight briefs. This simple change can allow your body the freedom it needs to restore itself naturally without unnecessary friction or compression. It might seem like a small adjustment, but I've seen it make a real difference for men trying to preserve comfort function and confidence. Now, you might be wondering, could something this simple really matter? The answer is absolutely. When you put all of these habits together, keeping your penis active, maintaining proper hygiene, avoiding injury during intimacy, limiting porn use, and prioritizing a healthy lifestyle, you begin to create a stronger foundation for your sexual health and overall well-being. It's not just about preserving function, it's about reclaiming your confidence, your vitality, and your sense of self. So take action. Start tonight, sleep without underwear, and give your body the freedom to restore itself. And as you continue to make these small yet powerful changes, you'll notice a ripple effect in your life. More energy, better intimacy, and a stronger connection to the person you truly are. Taking care of your body, especially as you age, is about more than just physical health. It's about dignity, confidence, and connection. The steps we've discussed today are not just medical tips. They are simple acts of self-respect. Each one reinforces who you are as a man with wisdom, experience, and value. By staying sexually active, practicing proper hygiene, protecting yourself during intimacy, limiting porn, and living a healthy lifestyle, you are not just improving your sexual health, you're enhancing your entire quality of life. Remember, it's not about trying to go back to your 25-year-old self. It's about staying connected to who you are, now a man who values his health, his relationships, and his future. If you found this video helpful, please give it a thumbs up. And if you want more practical, no-nonsense health advice, tailored just for you, hit the subscribe button and turn on the notification bell. I'm here to help you navigate your health journey with confidence. I want to hear from you. Drop a comment below. Tell me how you're planning to implement these steps in your life, or share your thoughts on the video. Your voice matters, and your journey matters. Let's keep moving forward together. Stay strong, stay informed, and keep taking care of yourself. I'll see you in the next video.